As reproductive psychiatrists, we sometimes get asked about more alternative type treatments. We want to talk to you about one of those today. My name is Michelle Haynes.
I'm Dr. Kristen Lassiter.
And we're Medical Mamas. This is your place for evidence-based information about your reproductive mental health.
Meaning we'll talk about mental health in relation to reproductive hormone changes, like around pregnancy, postpartum, menopause, premenstrual disorders, and infertility.
Today we're going to be talking about bright light therapy as a treatment option for depression during pregnancy and postpartum. Okay, so I think it's important to establish that we're not talking about just like the lights in the room.
Yes, no, these are specific lights that have been studied that are used as a treatment for mild to moderate depression or depression symptoms.
Right, so we would want to look for a light box that is 10,000 lux. And the treatment that's been studied, I actually saw two different things when I was doing my intense research about this. There are two different ways of approaching it, but I think for the purposes of this discussion, we would say something around 2 to 6 weeks of 30 minutes a day, first thing in the morning, of the light hitting your eyes, because if it hits your skin, that doesn't count. It has to go inside.
Although you're not supposed to stare at it, so it's supposed to be more like at an angle, so not directly in front of you.
Don't stare at bright lights, please. Well, the ophthalmologists are like, no. Yeah, so the light just has to get in your, you have to be able to see it, basically.
Yeah,
is what it is. Okay, so
not directly.
Also, just to talk about a little bit about how it works.
Did we mention it had to be 10,000 lux?
Yeah.
Okay.
10,000 lux is the key word.
Although I think it has been studied in a little bit less for perinatal depression, but in general, look for 10,000 lux.
Right. So also just to briefly talk about how it works is that it's suspected that the light in your eyes then affects your brain, and it basically works on the serotonin in your brain, and kind of how that works in there isn't really complicated, but basically more light can improve mood.
Yes, at certain times of the day.
Right. Another thing, we talk about serotonin being a precursor to melatonin, which everybody knows kind of helps you fall asleep, get sleepy. So if you have a lot of serotonin around, it gets converted into melatonin, and you don't want a ton of serotonin around right at the very beginning of the day. You want melatonin around the very end of the day. It's just really complicated. So okay, this is not going well. You just don't want to put a lot of light right in your eyes right before bed.
Right. So once the sun sets, that's kind of when you want to be dimming lights and things like that. And that circadian rhythm that we've talked about in previous videos, that sleep rhythm, can also be really helpful for your mood and improving it. And so having the bright light early in the morning, or even just going out for a walk early in the morning, opening all your blinds, that can really help improve your mood too.
Right. So there was a study done in 2023. It was a meta-analysis. I think it was done in China. I'm really hopeful that's correct. If it's not, I will correct it. But basically, the bright light therapy, as we discussed it, has mild to moderate effects for depression in the perinatal time, so pregnancy and postpartum. And then it had moderate improvements for sleep specifically. So in the morning can help you get sleep at nighttime. So we know that sleep is so crucial. We have so many videos on sleep that it could be a really helpful option for some people who are not interested in taking medications or have more mild symptoms.
Yes, and one of the reasons sleep is so important is that we see that insomnia in pregnancy is tied to a risk of having postpartum depression. So we don't know if that's necessarily a cause and effect relationship, but we do want to make sure that we're optimizing sleep as best as possible. And so this is another way to kind of help get good sleep.
And the other thing to consider is that, side effects of anything, right? So I think the most common side effect reported was headaches. Some people had issues with sleep. That was like about 1 in 4. So it's not something you want to just do without talking to your physician about it beforehand. It's not without risks, but I think it's relatively well tolerated by most people.
And I will say, in people who are having depression, but they have bipolar disorder, doing bright light therapy, especially if you're just automatically starting out at 30 minutes a day, can actually trigger some hypomanic or manic symptoms. So you want to make sure that if you do have bipolar disorder, you're talking with your doctor before starting this treatment to make sure that you're doing it in a safe way.
Right. Lots of little nuances there. Yeah. Okay, so I hope that was helpful. I think bright light therapy is promising and can be good for the right person. Just maybe talk to your doctor about making sure that you're the right person for that. Thanks for being here. Please like, comment, subscribe. We'll see you soon.
Bye.